My guest today is Dr. Jill Carnahan. Dr. Carnahan specializes in functional medicine and mold environmental toxicity. She's the author of, she also has a movie, the book Unexpected: Finding Resilience Through Functional Medicine, Science, and Faith. When she was 25, during her third year of medical school, she found a lump in her breast. She beat cancer. Treatment, however, left her bald and malnourished from chemotherapy and radiation, to which 6 months later she was diagnosed with Crohn's and autoimmune disease. Her passion for nutrition, lifestyle, and medicine therapies became instrumental in her recovery. She told her doctor in med school, I think, and he said, diet has nothing to do with this. Treatment's going to require steroids, medications, and surgery. Refusing to believe those were the only options, she studied the healing powers of food and other modalities, made changes in her diet, and returned to optimal health. Welcome to my show, Dr. Carnahan.
Thank you, Daniel. It's a delight to be here with you.
So tell me, that's quite a backstory. Tell me, we only have an hour. You're in school and you find you have breast cancer. Take it from there. And I'm assuming you didn't really know about functional medicine and these things back then.
Well, I grew up on a farm in central Illinois, so we had this ethic. My mom was a retired nurse to take care of us five children, and we had an organic garden obviously we had a pediatrician. We went to normal doctors, but there was definitely an ethic around food as medicine, living in the soils are important. Like we had this understanding that there was more than just drugs and surgery. So I kind of had a very holistic upbringing in that sense. And my mom was always, if there was a tea or a chicken soup or something before you'd get an antibiotic, she definitely would do that. So there was this, understanding and a good, solid family situation. But what I realized was I wanted to go into allopathic medicine because at that time, and probably still today, it's the best reimbursed system. So if I wanted to go to mission work or do anything different, it just still is, unfortunately or fortunately, in the US, kind of the
Allopathic, meaning
meaning MD, medical doctor. Yeah, like a typical medical doctor. Yeah. And I say that because I went into there somewhat infiltrating, like I had thought about physical therapy, acupuncture, osteopathy, chiropractic. I had thought about other professions that were much more alternative, but I realized, gosh, I still want to learn great medicine and then I can broaden that. So I just say that because I actually did go in with a little bit of a bent. I had never heard of functional medicine, but I knew in my heart there was more than just what our standard of care was. And I wanted to learn kind of the best system and then expand that. I just didn't know how. I didn't know that there was such a thing as functional medicine. And then the divine kind of saw this as healer often happens and gave me my own blight with breast cancer at 25, aggressive, where you mentioned to start the tale, found a lump in my breast during my
well,
surgery.
it looks like you lost your hair. Well, I guess it's chemotherapy that'll do that to you, right?
So I had found a lump in my breast, went to surgery. It was aggressive breast cancer. And then I was given three drug, very aggressive chemotherapy because of my age and because of the aggressiveness of the tumor. So pretty much everything they could throw at me, conventionally they did. And that therapy for the cancer is what caused me to be so sick, which is pretty typical. I chose it. I don't have any regrets, but it was brutal. It was pretty much a couple of the drugs had cardio heart toxicity, and I was given the maximum doses they could calculate for my weight, like lifetime dose that you could ever receive before your heart stops beating. So, I mean, they hit it with.
I've lost a friend, a good friend, because granted it was a little extreme. He knew someone who had cancer, and he's like, yeah, he's going to get chemo. And I'm like, that's going to kill him. Has he tried something else? And he got so angry with me, he would never got over that. I'm like, okay, I mean, you could do the middle, but it's harsh.
It is. And I went in with full, like, eyes wide open because I knew it was going to be harsh. But talk about losing my hair. My gut was destroyed. And I did not know it, but I had silent celiac, undiagnosed celiac disease, and I'd been eating gluten. And then I also had this damage of my intestinal lining from the chemotherapeutic drug. So that was this double whammy that 6 months after I finished my treatment for cancer, I was diagnosed with Crohn's disease, which again, it was kind of the perfect storm. And then that led to that.
Come back to your story. I feel the need to interrupt because this is the second time I had this thought in my head. you paint this picture growing up on a farm, kind of, right? And you're eating healthy food, you know better. How do you think you became so sick in the first place?
Yes, great question. So I did not know this, but that farm, that beautiful, idyllic Norman Rockwell-esque life was slowly killing me because
Hmm.
in that central Illinois region in the 70s and 80s, there's a lot of chemicals used to farm corn and soybeans. And a lot of those
Uh,
chemicals have endocrine disrupting effects. So probably our well water and even my mother in utero probably had exposure that, me in her womb could have gotten exposure to these things like atrazine and organophosphates and pesticides that have these estrogen-like receptor effects on the body. And more to that tale is the fact that my sister, who is 7 years younger than me, when she was 27 years old in her 20s, was diagnosed with thyroid cancer. So, two endocrine types of cancers, two young girls on the farm in their 20s. And granted, there's probably some genetics for us that were maybe poor detoxifiers, but also there was a toxic load that we were exposed to. That was kind of hidden because
hmm.
grow up in this nice farm environment and you don't think about that until later.
Hmm. And the engineer in me, by the way, is like, well, let's go test the water. Let's go test the
Yeah.
pro the the food, the water. It sounds like you did enough of that. And it doesn't matter. You need to get healthy and get out of the environment, right?
Well, it's interesting you say that because I'm such a thinker as far as the why, and I basically an engineer mind. I went to bioengineering as an undergrad, so I always like to put these things together, and I'm very analytical. So after my cancer, that was part of my question. Just like you said, I said, well, why? Why did this happen to me at 25 years old? And I went and looked back at my dad's old farm records, and they were all endocrine disruptors. And then I
Hmm.
started looking at atrazine in particular, and I saw in Central Illinois, where I grew up, was the hottest spot of usage in all of the US. I called my dad and I said, Dad, are they still using atrazine? This is about 6 months after or sorry, 6 years after my diagnosis. And he said, Yeah, Jill, we still, and even to this day, now 20 plus years, they're still using atrazine.
Yeah, what's wrong with it?
Right? I know. And in Europe, it had been banned since 2001. So it's been a long time banned. And all that to say that just recently, 2023, just a couple years ago, a paper came out showing atrazine linked to breast cancer. Whereas I knew this likelihood years and years ago. And now the research is finally coming around to support what I've thought all along, and that these chemicals probably had a pretty significant impact on my cancer.
An ironic twist, the pesticide manufacturers are a big sponsor of the Pink Ribbon, the Anti-Cancer
Yeah.
Foundation. And did you is your father still alive?
Yeah. Yeah.
Did he ever come around going, Jill, I'm sorry, I didn't know.
Oh, my dad is amazing. And what's happened is my brothers now farm and my dad is still around and helping them out. But they have gone 100% non-GMO, which means no genetically modified organisms. And they are partially organic, which is almost unheard of in corn and soybean central Illinois. Like organic farming is not a thing, but they are doing it. And part of it's because myself and my sister and our journey has really brought awareness. And I'll never forget in the movie, you mentioned my documentary, sitting by my dad in one of the premiere screenings and like literally holding his hand as an adult daughter and like watching my, life pass before me on the screen. And like we looked at one another with tears in our eyes, and he's like, Jill, I'm so sorry what you had to go through. Now, there is no blame. He did not cause any of this. But as far as like compassion and understanding of how the farm did.
He's doing what he was taught in economics. He's got a family to
Yeah,
support.
exactly. I have no problem with what they did. You do
Yeah,
better until you know better. And the fact is, they all are doing differently since I've gotten the cancer.
great. And so then tell me about how you got well again. Yeah, that process.
So the chemo really, as you mentioned, I mean, it destroyed me, destroyed my gut, my skin. I lost all my hair. I was down to the lowest weight since maybe like 11 or 12 years old. Like I was really, really sick. And one thing that was interesting was I had this farm mentality, pull it by the bootstraps, don't complain, toughen up. I was surrounded by brothers. So this energy of just like, don't complain and get back to work. And so I did. I just went right back to med school. Looking back, I wish I could shake that girl in her 20s and be like, sweetheart, take some time. You just went through this like crazy thing. I didn't, though. I went right back to work. And in that, I was still very malnourished and very sick, trying to perform the duties of a third year medical student, which is brutal. I mean, 36-hour shifts and crazy, no time off. So I was doing that in this very crazy environment. it kind of is no wonder then 6 months later I developed Crohn's disease because I was just still so sick from the chemo. My
Or
gut was
tired, just worn
oh,
down.
exhausted, exhausted. Yeah. So I, tried to get back in it, but I was still really sick and I started having cyclical fevers and abdominal pain. And then one night I literally passed out in one of my emergency rotations, was taking myself to the emergency room, found out I had an abscess, and I woke up to the surgeon telling me, Jill, you have Crohn's disease.
Is that a easy thing to diagnose that fast and quickly?
Well, I had an abscess in my bowel, and so there's some characteristics of certain types of things, especially abscesses, that can lead them to say it's likely. I think it was actually, it's very likely you have Crohn's disease, and then subsequently they proved that that was the case. But just looking at the biopsy of the abscess, I think he thought it looked like a case of Crohn's
What
disease.
is Crohn's disease?
Yeah, so there's this category called inflammatory bowel disease where basically your own body attacks the lining of the bowel. One is ulcerative colitis, which is more the distal, the end of the bowel, and the other is Crohn's disease, which can attack anything from mouth all the way down, stomach, any part of your bowel. So it's this inflammation attack of the lining of your bowel. So you have malabsorption, pain, and often like I had cyclical fevers. I would have these fevers go up to 102 every other day, every day. And I was working just through those fevers. And if anyone who's had the flu knows what it's like to feel feverish, it's pretty gross. And I just like
Your
went,
body's trying to, with the fever, trying to fight the
yeah.
disease. The inflammation, tell me, explain how what your body's trying to do with that. It's like if you have a broken bone, the inflammation's to try to keep you immobile. What's it doing the Crohn's with? Why does it do the inflammation?
Well, to go there, it's very interesting to think about. Number one, I have a gene mutation, not uncommon. It's called NOD. This gene means that microbiome contents, which is the microbes in your gut, if they leak into the bloodstream, which can happen through leaky gut, your body, someone like me, has a more aggressive response to those microbes getting into the bloodstream. So that kind of frames number one. Number two was I didn't know it. I had celiac disease, which means I was on a gluten-full diet. Was not gluten-free. And that gluten is a trigger for inflammation and permeability. And then you throw the third thing in, which is the chemotherapy that I got received for my cancer. Actually, part of its mechanism is inducing more intestinal permeability because when you dump those contents into the blood, you get an aggressive immune response for the cancer. But what you don't want is that aggressive immune response that attacks the bowels, which led to Crohn's. So it's kind of the perfect storm of my genetics with celiac and Crohn's predisposition, plus the chemotherapy, the damage to the bowel lining, the dumping of the contents into the blood, and my immune system revving up and attacking
How,
its own self.
how'd you figure it all out and solve it and get well again?
Yeah, well, that's my detective work. That's my like what I do in clinic and for myself. And it's funny because I kind of had to be with cancer and Crohn's. The stuff I do in clinic nowadays, that's exactly what I do. I look at this big amount of data for someone and all of their genes and like
It's
stacks of data.
15 pages.
Yeah. Oh,
I went to your website and I was expecting functional medicine to be kind of like yoga or something alternative, a little more simpler. 15-page intake
yeah.
before you see anybody, right?
Yes, you're absolutely right. And then that's among other forms. So yes, we go really deep. And so I've been practicing the same thing with my own life for decades. And what I had to do is really get down to the why and say, well, why did this happen? Could it have been a trigger in the chemicals? Could it? And it ends up functional medicine for me comes down to two things. And this almost always explains most of the complex chronic disease that I see. One is toxic load. So the things in our environment we don't know that are harmful to us, like toxic chemicals, pesticides in our well water, the air that we breathe, mold in a home, etc. And then the other thing is infectious burden. Many of us have had Epstein-Barr, chickenpox. Some of us have been bit by a spider or a tick and have some other infection. And if our immune system is robust in keeping things in check, we're fine. But when you have a toxic load that's unknown to you and it's weakening the immune system and you have these old infections, those can start to pop up instead of being dormant. So Epstein-Barr can cause chronic fatigue. Tick-borne infections can cause pain and inflammation. So those things combine to create immune dysfunction, inflammation, autoimmunity, neurodegenerative diseases, and all of that then presents with someone having Crohn's or
So
colitis.
did you, I've kind of looked, I don't know if AI was helping with questions to ask you or if you gave them to me in a cheat sheet, but a lot of them have to do with this gut and inflammation. Did, um, did, did you think focusing on just being healthier was the big factor? Meaning, instead of surgery and medicine, just
Hmm.
live a healthy lifestyle?
Yes, and I was voted in my 1994 graduating class as the most healthy of my graduating class. Like
Congrats.
I practice, and I say that not for bragging, but I'm saying that I was, in high school, you're like 15, 16, 17, 18. In high school at that young age in my teenage years, I was eating so clean. I was swimming and running. I was doing all the right things. In my teen, I wasn't drinking alcohol. Like I was actually living a very clean life from a young age, committed to that.
Hmm.
And I
Thank
still
goodness it could have been worse.
right? And I say that because like this wasn't someone who was drinking alcohol, smoking cigarettes, staying up late all the time. I mean, granted, I was a teenager, but for a teenager in that era, I actually lived a very deliberately disciplined and clean life. And then I still got sick. So back to your question, it's not all about living a clean life. And this is where I go deep with patients. Sometimes it's about healing old trauma. Sometimes it's about you're eating gluten and that even though it's not toxic to everybody, it's toxic to you. Or sometimes it's about old infections or inflammatory conditions that are not under control, and looking for those root cause will often change the trajectory of disease.
And so, can you give me an example um, of someone else who, be common, like a common, one of your patients, common thing you see? What is the common thing that people come to you for?
Yeah, so I end up dealing with complex chronic things like fatigue where there's no explanation.
Oh,
Uh,
good one. Fatigue.
yeah,
Love
just
that
plain old
one.
fatigue.
Chronic fatigue. Yeah.
Chronic fatigue or brain fog or cognitive
Mm-hmm.
dysfunction, or an autoimmune disease where they don't know why do they have this lupus marker, why do they have a skin disorder, or why do they have just even IBS, which is irritable bowel syndrome. Some of these things where they're just told, you just need to learn to live with that. So those are real common. And what I do is then go to the root and say, do you have to live with this forever? Is there some way that we can find a root cause, a contributing factor, and reverse that trajectory, reverse engineer? So that you can live well and feel great and not have the symptoms that you came to me with.
So if it's not all environmental, which reminds me, by the way, it must have been when I was growing up and a kid in the 70s, Scientific America, it was basically saying all cancers are caused by an environmental factor, your pesticides, your whatever's in your water and so forth. So if you're being clean and you still trying to follow this thought, you still something's wrong with you. That's because genetically or some diet you're not really clear about. If it's not an environmental thing, how do you identify what the problem is and correct it? Do you give
Yeah.
them supplements, not vitamins? You
Yeah.
treat it that way?
So the truth is, even if you think you're living clean, you're probably not because we're all swimming in toxic soup. And 80% of the toxic load is the air that we breathe. And how many people are really deliberately thinking about the air that they breathe as a toxic load? It's pretty rare. Most people are just going about their thing, thinking they're fine, and they're inhaling nanoparticulate from exhaust.
What immediately comes to my mind is I'm amazed at, okay, I can get one plug-in air freshener, not good for you, but I'll go into some people's houses and it'll be half a dozen plug-in air fresheners. And then I'm staying with someone as a guest, they'll have washed their sheets
Yeah.
multiple times in the most fragrant laundry soap.
Yeah, these things are VOCs, volatile organic compounds, and they're everywhere. As I've looked at houses to for sale, some of them are so full of the VOCs, you just like walk in and walk right back out.
For
But
VOCs, your audience and probably, I don't know about mine, it's kind of mixed. VOC, volatile organic compounds. Tell people what you mean by that.
yeah, so any of those artificial plug-in air fresheners, if you have new cabinets, the off-gassing of the cabinet wood, the laminate wooding, or if new flooring will off-gas often formaldehyde, smoke from exhaust or smoke from combustible, say you're near an airport or near a busy road. All of those things, basically the gases in the air, so formaldehyde, smoke, microbial VOCs would be if we have mold in this wall behind me, it could be putting off mycotoxins, which are like microbial. It's from microbes and they put off VOCs. So these volatile organic compounds are less than 2.5 microns, really, really tiny. A classical HEPA air filter won't grab onto them. So you really need like a air filter that has a carbon core if you want to filter out those VOCs. They tend to go really high, like if there's wildfires or if there is mold in your home or in your workplace. Those are the kind of situations where you can have a really big exposure to VOCs.
So we're kind of backtracking to where it is your environment that's
Yeah,
making you sick.
That's what I was getting at. We think, oh, well, I live, and I thought I lived clean. I still think I live clean. But the truth is, unless we're deliberately, I would say clean air, clean water, clean food, we have to be deliberate about the inputs. We have to be thinking about, do I drink from plastic water bottles? Is my water filtered? Do I bathe and shower in filtered water? Am I filtering my air? So those things that we maybe took for granted years ago.
And then we have the food, which I don't know why this how things pop into my mind.
Huh?
Um, Maybe I'm picturing myself, okay, I got clean air and I'm good. And wine and alcohol beer, like I've heard no alcohol is good for you. Me personally, I try to avoid having more than one or two drinks a week, if that. What's your take on that? Like, oh, glass of wine a day is good for you. And then how's beer different from that?
Yeah, so I have come to see that it is a toxin. It's a mycotoxin. It's fermented. And for most people, especially my population, which is chronically ill or has some sort of issue, no alcohol is better than one drink. Now, if you were to really, I'm going to say something different than what you've probably heard before. If you were someone who thinks that you're super clean and you can tolerate a little alcohol, maybe one drink a week or two drinks a week or something small, I'm going to be the one who's going to recommend a potato vodka or tequila over wine or beer.
Hmm.
And the reason for that is often the wine is fermented and is high histamine or high sulfites or high oxalates. So those are three big categories that bother people very
Oh,
frequently
yeah,
with
the
gases.
sulfites that they add to
Yeah,
wine to stop
headaches.
it.
It's also frequently, at least the US, they add sugar, so it's very high glycemic, it's high sugar. And then beer is definitely fermented and it's usually from grain, often from wheat or gluten. So for that reason, the fermentation progress, the sugar that's made in beer and wine is often a much bigger deal for those who have gut issues. Now, if you have a perfect gut, you could probably get by with a glass of wine. But in general, and myself included, I have chosen to be completely abstinent from alcohol just because it doesn't do well for guts and it doesn't do well for adding to toxic load for most people.
You reminded me that that it is from uh, fermentation. It'd be yeast, but yeast technically is a fungi, a mold.
Mhm.
And then grain, well, that could be mycotoxins in the food, the grain, wet, moldy grain, right?
That's exactly it. The most common source in the US of mold in our food supply is grains. I really believe, nowadays carnivore, paleo, some of these diets are really popular. People are like, I lost weight, I feel better. I think part of that is because when you eliminate grains from the food supply or your diet, you eliminate a lot of the sources of mold. So people do feel better. And I think maybe they're not realizing it, but some of it's from the lack of mycotoxins.
Yeah, I'm looking for the for my note where it said when you were getting well and you're eating right, you said I even started to eat chicken or something like that. Like you were a vegetarian, not very much, and then you started
Yeah,
eating
so
more.
I was at 14, I was on a farm and I was like, I don't feel well. I'm going to be vegetarian. Now, I had no role models. No one in my family, we were steak and potatoes farm family, right? So it was not a family that was like, oh, yeah, no big deal. So I tried to do it on my own. I didn't really know what I was doing. And I ended up being more of a carbitarian because that's what was available, like pasta or pizza or rice or whatever. And I tried, and unbeknownst to me, number one, I had silent celiac, which means that gluten was a trigger for inflammation, not knowing that. And then also looking back, I was deficient in both B12 and zinc, and especially with a B12 deficiency, you're going to go worse when you don't have meat because meat is a big source of B12 for absorption for us. And then the zinc deficiency often leads to someone to not really like the taste of meat. So I think that those two things played into my desire to become a vegetarian. And then when I was 25, with the cancer, I switched and I started eating meat again just because I realized that that kind of a vegetarian diet was not good for me.
Awesome. So for someone who does have fatigue, real common symptom, or is not feeling well, not so bad that they need to go to the hospital
Yeah.
right away, but they're listening to the show, what's like the top one or two, three things you would tell them to do
Yeah.
in addition to, booking a consultation with you, what they could try at home first themselves?
Yeah, so the first thing you want to do is look at the endocrine system because the hormones, male and female hormones, the adrenal glands and the thyroid have a lot to do with energy production. So you want to make sure morning cortisol is at least, say, 10 or 8 or 10, somewhere in there and above. TSH should be less than 3 and above zero point 0.3. And a few basic things where your labs look optimal range for those hormones, because those are critical for energy. Second thing would be mitochondria, and you can often just add support for mitochondria because they're in every single cell and they make the energy. And things like chemotherapy or lack of sleep or toxic chemicals can affect those, but you can support them with things like coenzyme Q10, PQQ, alpha lipoic acid, acetyl L-carnitine, and I could go on, but a lot of these formulas have the
I know what the
mitochondria.
CoQ10 is. It's been around so long and
Yeah.
so popular. I don't necessarily feel a difference, but it can't hurt, right? It's expensive.
Yeah, and it just depends if you're targeting, so say your mitochondria are fine, but your fatigue's from thyroid, well, then you give mitochondrial support and you won't feel better. So it's a trial and error. And if you were seeing me, I would do the labs to find out which things are problems. The gut's a big deal. So if you do have permeable gut or food allergies, you want to clear those out temporarily so that you can fix the gut. And then things like chronic infections. So Epstein-Barr is a big one that can be reactivated and contribute to fatigue. So if there's an infectious burden, I see Borrelia, which is also known as Lyme disease, and Epstein-Barr both being culprits to someone with chronic fatigue. And then toxic load. Mold is a big, big player with cognitive dysfunction and fatigue.
And so imagine I'm fatigued, I'm tired. Oh, I would need to get a doctor to do the blood panel. You just
Yeah.
named off some stuff. I would need to do a basic blood panel for that, right?
Yeah, and nowadays a lot of patients can order their own labs, but you'd need to know the basics of, what to order. But if you look at comprehensive metabolic profile, blood counts, you want to make sure you're not anemic. The hormones I mentioned, adrenal, thyroid, male and female hormones, maybe rule out autoimmunity and then toxic, infectious types of things. And most of that can be done through a routine lab. Sometimes I do specialty labs as well, but you can do a lot of that through the major medical labs as
Oh,
well.
so if you, a lot of functional medicine doctors don't take insurance. So you could potentially coerce your normal allopathic
Yeah.
doctor to go, just do this, doc, what you're talking about, and then go from there.
Yeah, you could absolutely ask your regular doctor to order these labs.
Nice. So talk to me about the mental stress. You mentioned trauma. Because like I'm fatigued, my immune system's down. Trauma, I think of a past event. How could it be bothering me now? Stress could be my job. What do you recommend people do to get that out of the way so we know it's not a factor and we can focus on the other stuff?
Yeah, so we all have experiences in our life that can be traumatic, and many people have the big T trauma, like, war or being abandoned or something terrible like that. Hopefully, most of your listeners aren't dealing with those kinds of things, but many people have small little woundings that happen in childhood that are pretty normal for us, like, differences between siblings or birth order or parenting styles or whatever. And those things, just dealing with those on a level where we are taking care of ourselves and healing that inner child that was maybe neglected slightly in this way or that way, those things can be really powerful healers. So the more we can do psychological work with a therapist, there's some things called somatic behavioral therapy. And if you want to read more or learn more about that, some of the greats are Peter Levine, Gabor Mate, Peter van der Kolk. These are just some of the ones who've written
I've heard
about.
of the semantic. It
Yeah,
just seems so many people try everything under the sun
mhm,
and they still,
yeah.
that's a tough one to battle and probably a big factor that in the stress in terms of your physical health.
Yeah, I think you just the awareness. You don't have to do all of that, or it's just an awareness around what patterns of thinking, what patterns of behavior, how did my childhood shape who, like I told you one in the beginning. So I grew up on a farm. It's all about, working hard, not complaining, being strong. So those are some of the things that I have dealt with in my life that have made me an amazing leader and entrepreneur. But on the other side, sometimes I've worked myself too hard and not given myself a break and become almost like a workaholic or perfectionist. So those processes of my childhood led to some great things, some skill sets.
Yeah.
But if I'm aware of how they're also a double-edged sword and at times cause me to overwork and not sleep and those kinds of things, then I can just be aware and I can change those patterns so that it's a healthier way. And that's what I think is the best. We don't have to read a ton of books or even see a therapist. We just have to be more aware of our patterns. So that's one thing. And then the other thing is just if we are having symptoms, kind of getting to the root, so looking deeper and trying to help figure out what is going on and what things are contributing. And then, like I started to say before, clean air, clean water, clean food, we can all start with some inputs that really do make a difference in our overall health.
I like the three: air, water, food,
Yeah.
because it helps them. What about detoxification? There's this popular, I don't know what they are exactly, detoxification. You fast and then you poop, or, and then you do some cocktail before you fast and stuff. Did you do any of that recovering from chemo? And what's your take on detoxing in general?
Yeah, so we all, I mean, our liver is a detox organ, our kidneys are detox organs, so we can put this in this relegation of like, oh, it's a 21-day detox. But the truth is, at any moment, even as we are both sitting here, our bodies are detoxifying, and that's the ideal. So, how do we optimize that? I do believe that we have to be conscious. And the first thing is detoxing has to do with inputs. So, realizing that the air that we breathe, the water that we drink, the food that we eat is putting in either toxic chemicals or clean. And so we can choose based on the inputs. And then we have less detox to do, right? Because if we're eating clean food in general and not drinking a lot of alcohol and avoiding mold in our environment and drinking water that's filtered, not out of plastic, those things already are going to make our detox load a little lighter. So, for example, I always say it's like we're born with a bucket capacity to detox. And over our lifetime, that bucket starts to fill up with exposures. And at some point, for some of us, like for me at 25 with cancer, the water starts to spill over the top. And that's an indication that we have overloaded our body's ability to kind of bail out the bucket. And when we think about it that way, then we can just think about, okay, how do we keep that water level down? And then how do we incorporate things? And those things could be Epsom salt baths, infrared sauna, exercise, especially aerobic, eating clean, movement, thought processes that are healthy, relationships that are healthy. And then, of course, choosing to avoid ultra refined processed foods, chemicals, alcohol if possible, maybe gluten for some of us, and choosing those things so that we have less of a toxic load with inputs.
So it sounds like you're not one of those that recommend off the get-go, do this 7-day fast or drink this cocktail for a detox.
I'm not because people are like, oh, I just did my January, detox at the spa. And it's not enough anymore to do this one-time thing and make it be like this special thing. It's more, I like to just incorporate habits that are simple and they can be for you what works. Like for me, I take an Epsom salt bath every night. It's so helpful for me. I feel so good. And it's something I can incorporate with ease without a lot of stress or difficulty. I make sure I'm sleeping and I get good, deep and REM sleep. And that's something. So those things are kind of non-negotiable. And it's not like I have to go to a spa to do it. I can just do it in my home. And I just encourage everybody to find a few things for them. It might be you have an infrared sauna and you use it 3 times a week, or it might be that you aerobically, you're a runner and you run 15 miles a week. So it's the things for you that you can incorporate on a routine basis that are much better than those detox. Now, having said that, if I deal with someone who has severe mold toxicity, I will put them on a very specific regimen to aid their liver and their kidneys and their gallbladder in eliminating those toxins and mobilizing them from the tissues and then moving them into the blood and then filtering them out with the stool and the kidneys and the urine or the sweat. So I definitely do very protocolized and prescribed detoxifications, but I think
And when you
more
do
important.
that, do you tell them to consider their grain or their food the source of the mycotoxins, to like change their diet some way so they're not eating or drinking anymore?
Yeah, we usually go with a mold-free diet temporarily, which is a little bit restrictive at times because you want to take out all the grains and the things that might have mold, things like peanuts, pistachio, cashew are higher in mold, any sort of moldy fruit you want to avoid. Things that are in cans and jars, like tomatoes, often have mold in them. Peanut butter can be like that. So you don't have to eliminate all of that, but you need to be aware of the inputs that might have mold and decrease the consumption of those foods. And then I'm always thinking about how do we mobilize past exposures out of the tissues where they've been stored. And that can be through movement and sweating and glutathione and infrared saunas and Epsom salt baths. Even things like bile acid sequestrants like binders can be helpful. Cholagogues, which cause bile secretion like bitters. So we'll use all of those things in a protocol so that someone is mobilizing those toxins so that they can then eliminate them from their body.
If someone's listening and they haven't really gone to a functional medicine doctor yet, but they've gone to their doctor a bunch of times, are there tests that they could be doing that traditional doctors just won't think of, won't touch, that again, they could ask their normal doctor, go, you know what? I'll go to a functional medicine doctor and get that test.
Yeah, so we talked about kind of blood work. Blood work, pretty much any doctor can do. It's just a willingness to do a more extensive panel, and that's easy. It's available at any hospital or regular lab. The other stuff that I do is going to be a little harder for a conventional doctor because they have to know which labs and sign up for those labs and get accounts with those labs. But for the general patient that I see, I do a slew of things. One would be a stool profile to check the microbiome and the environment of the gut. Are they digesting? Are they absorbing? Are they having enough detoxification at the gut level? So I will do a stool test of some type. I will often do organic acids through the urine, which shows me metabolic processes related to neurotransmitters, B vitamins, detoxification, other markers for the gut. So I get a whole panel of things that tell me about what's happening inside the body. Frequently,
Wow. It's a
yeah,
lot. That's a
frequently I'll
lot.
do a deep hormone panel with 4-point cortisol testing. So morning, noon, evening, and night. So I can map the cortisol, the adrenal function through the day and look at all of the hormones in the entire body. And then I will also often test for infectious diseases. I can do some of that on routine labs, say, Borrelia, Bartonella, Babesia, Ehrlichia, Epstein-Barr, CMV. There's a ton of them that I can check for. But there are specialty labs that look at infectious diseases as well.
So I imagine is a challenging job because you have people that get well in right away a couple weeks or a month, and then ones who really struggling for because either because as an engineer we haven't identified what reminds me when they were designing the Boeing the first Boeing 747 and trying to figure out where the flutter was coming from on the wings and then had to add weights under the wings to
Yeah.
otherwise it would crash and they had weights on the wings forever. You got to figure this stuff out. What do you do when you run into someone? What do you tell them? Like, just stick with it. I can help you. What words of encouragement?
So the healing starts with creating a safe container or space for someone to be heard. And I know that, and I practice it very deliberately because I know that that person walking in the door has probably had 5, 10, or more experiences with other doctors that either said, your labs look fine. I don't know why you're tired. And that pattern of it's really gaslighting in a way where someone's like, well, I don't feel well. Maybe it's all in my head. Or worst case is when someone truly doesn't feel well and their doctor will say, well, would you like an antidepressant? It must be depression. Now, there is real depression and there's a real reason for antidepressants, and I prescribe them myself. However, not every ill that can't be explained by routine labs is a depression. So I take a problem with that. And so when a patient comes in, the first thing that's important is to listen and to just let them tell their story. And for me, it's creating this space that my office isn't pretty warm. It's not white walls and our staff is lovely. So hopefully when people come in the office, they feel that sense of this is different. Maybe I'll be,
That's another big one. I'm glad you mentioned that. Depression,
yeah.
because it's tied with fatigue.
Yeah.
Seems like they go close together, right?
Yeah. Yeah. So often I'll ask, if you weren't tired, would you feel depressed? Because they can be very, very connected. And that's how someone will say, yeah, gosh, if I had energy, I wouldn't be depressed. And I know its primary issue is fatigue, and they're getting depressed because they're so tired. That's very real. But then there's also another sort of depression where someone's really, really depressed. And even if they had great energy, they'd still be laying in bed and not motivated and
What
feeling.
is so real quick, how do you tell the difference? What is a real depression versus I'm tired because of the mycotoxins in my food are affecting my immune system? Um, how do you tell the difference?
Well, I've done this long enough where I truly believe, I don't know that I've ever seen a case of depression where there wasn't an organic cause, meaning there was something either genetics, environmental toxicity, infection, fatigue, cognitive issues, lack of function of some sort. So I don't know that I've ever had a pure depression without another cause. And I'm not
That's a book right there. That's a new book.
honestly, yeah,
I've
yeah.
never heard anybody say it that way and really own it.
Hmm.
I believe this is we're chasing the wrong ghost here, and
Yes, yes. Which means it's very treatable. And again, not
that's
everybody.
positive. Yeah, very
Mhm.
hopeful. It's because I mean it's even my nephew, he graduated with a degree in neuroscience and he's got the textbook and I'm a aerospace engineer, so biology is not my thing. And his textbook's fascinating, man. And
Yeah,
he's like, Uncle Dan, meds don't work. Not the problem. I'm like,
yeah.
really?
Interesting.
Like, tell me more about that. Yeah. How do you know that so sure?
Yeah. Yeah, no, it's really the more I dive into it, and the gut is connected to the brain, and so there's so many different things. Uh, I guess one thing, like when someone comes in with fatigue or depression or any of these things, even if they've been to 10 other doctors and they're like, I can't help you, I still don't, I don't know, I can't think of one case where I've had to be like, I'm sorry, I don't know what else we can do. So there's always more, there's always deeper, there's always more places you can go. And that's been part of the success is just, I don't give up. I'm always
Sounds
willing.
like an interesting job.
Yeah, it is. I love what I do.
So tell me, before you tell me about your movie and your book, did your movie come out yet or it's coming out?
Yeah, it's out now on Amazon Prime and on YouTube and Tubi, and you can watch it for free at it's just drpatientmovie.com.
It's going to be in the show notes.
Yeah,
What haven't we talked about? What haven't I asked you that's really important for people to know who say they got fatigue, or I was going to say just want to be healthier?
yeah,
More the person, fatigue is a common one.
yeah.
What's, what haven't I asked you, or would you like to add that I haven't asked you?
So one thing is the sleep we talked a little bit about, but I feel like so many of us are going late hours on our phones and having in the bedroom lots of blue light or lots of EMF devices. Maybe we don't put our phone on airplane mode, and those things really do disrupt sleep. So I feel like sleep is always the one thing you have to go back to and make sure that someone is really getting good sleep before you assume anything else. And I'm talking 7 or 8 hours of good deep and REM. I think you want about an hour or more of each REM and deep. And nowadays, with the Aura and the Fitbit and the Apple Watch, you can track these things pretty easily. Although there are people who are more sensitive to EMFs, so having a lot of electromagnetic devices on their body or in their bedroom could also affect sleep. And then devices have a
So you may have just gone over some people's heads, not your kind of clients and whatnot. I think what you're speaking of is next to things plugged in next to the bed, the lamps,
yes.
anything with the cord, right?
Yeah, and especially our cell phones are a big one. Our device, like I wear an Aura ring and that puts off Bluetooth. So I'm not super sensitive. I can wear that, but some people that's too much. It actually affects their sleep to have a device that's getting data back and forth. So any device that shares data, if it's on your body, you need to just think about it may not bother you, but if it is, you might feel better taking it off at night or turning the Bluetooth off at night or your phone putting it on airplane mode. And you're right, the plugging in of devices and our routers, if your router or there's a smart meter near the head of your bed, there's certain things that put off. The big things that I always think are any sort of router that's near your sleeping area. A smart meter puts off a lot of EMFs. And then my Sonos speakers, which are wireless high fidelity speakers, I love them, but they put off a lot. So those are the kind of things you might want to turn off or unplug at night for optimal sleep. And then getting that sunlight in your eyes within 30 minutes of waking is really important for both daytime
Okay.
energy and sleep. So I always go on my east balcony to water my flowers as the sun is rising, and I get that direct sunlight into my eyes. That's a really good way to feel awake and refreshed. Yeah,
I
those are
always leave my blinds open so the sunlight
perfect.
wakes me up. If I'm feeling really lazy, that's when I close the blinds and sleep
Yeah,
into it.
that's ideal for people. I mean, blackout shades for some people, they can get better sleep, but if you can let that natural sunlight, I've traveled all over the world and I don't ever get jet lag because I know how to hack it. It's all about light and food. And if you give your body the right clues, you take the, light and block it when you're supposed to be sleeping and you let the light shine in your eyes and then you avoid meals when you're not supposed to be eating, it really is very easy to hack jet lag.
I've heard I used to be one of them, but I don't drink, like I say, don't drink that much. But even in those times, I want to fall asleep, I'll have a glass of wine or
Hmm.
maybe a beer, but something like a glass of wine. And then I've heard this people say, no, that's backwards because it does something up or down, then you wake up in the middle of the night tired. What do you believe on that in terms of does it help or hurt to have a glass of wine to help you fall asleep or something to drink?
Yeah, so benzodiazepines, alcohol, anything in the GABA receptor area tends to not really get you deeper sleep. So you feel like you're relaxed and so you may fall asleep, but the actual REM and deep sleep that you're getting after drinking alcohol or taking something that's like a benzodiazepine like Valium or lorazepam or those drugs, which a lot of people do, really doesn't enhance your sleep quality. So it's great if
Oh.
you're short term, like again, if you're going to a foreign country and you need some sort of a sleeping pill for a week or two, or you've just lost a loved one and you're trying to deal with grief. I mean, there are reasons for that, and there's nothing wrong with it. But long term, it is not a great strategy for great sleep.
Well, especially if you start needing,
Yeah.
I do the math, it's like a beer a day is a six pack a week. That's four
Yeah.
six packs in my fridge
Right.
every month. You
Yeah.
look at it like that. Okay, that's a six pack and that's just one a day, right? So
Right. Right.
and can't be good for your liver. But
Yeah.
I know a lot of people struggling. Well, then I can't sleep and I have a tough day. And I feel grateful sometimes that I don't have the
Yeah.
problems that some other people have.
Yeah, the sleep is core, and anyone who can't sleep knows how tough that is. But then there can be some simple things, and often it's strategies that you think about well before, like getting sunlight in the morning actually affects that night's ability to get a good night's sleep. Your kind of meal and how close that is to your bedtime. If you eat a large meal right before bed, you're going to have more disrupted sleep. So you want to leave at least 2 hours. If you really struggle with sleep, you want some good complex carbs in your evening meal that will help you maintain blood sugar while you're sleeping. So there's all these little tricks that can help a sustained healthy sleep if you can't get to sleep.
So what's next for you? You're healthy now, your movie's out, and you also have your book. Uh, anything else in the works?
Yeah, so I'm just building the clinic and continue to try to see patients and also I'm training some other doctors in mid-level so that we can continue to do the work. And that's the one thing. This year I've been more playful and included more. Talk about the hard work from the farm, right? I've worked hard all my life, and I feel like this year I really tried to pull back on travel and be more present and just continue to live a life with joy and connection is really the goal, I think.
You know, that's a good one. I started my podcast as an engineer and environmental guy.
Uh-huh.
Like to me, it seems the biggest thing affecting people, they don't do what they really want to do. Like I want to go climb, in Colorado, a
Yeah,
14er.
yeah,
What's stopping you?
right.
Well, I looked at it on Google. Okay, good. Have you just driven to the trailhead and
Yeah,
looked and I think that's a big one.
yeah.
You like you're saying just to not necessarily it won't make you happy, but it certainly can't hurt.
Yeah. And again, just from my own perspective, I was working hard. I loved my life. I mean, I was doing book tours and movie premieres and stuff a couple years ago, and it was amazing. But what was happening was I was talk about sleep and connection. I was going so much of a pace that was unsustainable. And I started to get really tired. And so for me, I had to really choose. So as you're talking about, if someone wants to do a 14er or they have these desires, often the pace of our life and the demands of our life prevent us from having enough free time and energy to
Hmm.
pursue what we really, really dream of or love. And so we have to make hard decisions by saying no to some things or not planning to do this work trip. Or so I had to really, over the last year, maybe 18 months, make some hard decisions on pulling back as far as what I was doing in the world so that I could make space for more play and enjoyment. And it's hard because you have to make those decisions. But I think as you're speaking to those people out there,
In the well, on the flip side, then they don't go for 6 months because they plan this big trip.
yeah,
And it's more stressful because
yeah,
we got to get off from work. We got to make our flight. We got to get to
yeah,
and what's going to cost. I'm like, just go.
yeah, yeah, yeah. I agree with you. Like you really, and so if you're listening and you just think of what would really make you happy, make sure that you're making time and energy to pursue that because at the end of our life, it's not going to matter, how much we made. It's going to matter the connections and the joy and the experience. I always say money is to buy freedom and experiences. That's it. The things are going to go away. But the freedom that we have to do things and then the experiences, the memories we make, And
Yeah.
of course, giving it away is part of that too, because we can create an experience for someone else. But those are the
You
really,
inspire people. I know people, all they did was, a woman, for example, an older woman, she just drove across the country by herself.
yeah,
Everyone told her she was crazy, couldn't do it. You can't drive at night, you can't go by yourself. And she did. And after that, everybody else in the family wanted to do it.
I love it. Yeah, we have to
Yeah.
kind of be out there on the edge, really practicing what we preach. And I continue to challenge myself because I'm not all there. But if I see an area where I'm not aligned, I want to be aligned. And so I continue to say, what would that take to get to that next level?
Yeah, I think it was Alice Cooper, the rock star.
Yeah. Yeah.
Speaking of illnesses, and
Uh-huh.
we know Alice, he's had a great life.
Yeah.
Rock star, but yet he's a family guy at home. You
Yeah.
wouldn't know he's
Hmm.
perfect life. He was, come to think of it, here's how life can turn on you. He's sick. He had such bad allergies. He lived back east, chronic, just a
Yeah.
mess medically, that his doctor suggested they move to Phoenix.
Uh-huh.
And he did. And he never
Wow.
had a health problem again. And that's what got him into music.
Wow. I love that story.
So a lot of variables here. So your office is in Louisville, Colorado, right?
Yeah. Yeah. Right near Boulder.
Older. So people fly in to see, or you do a lot of virtual consults?
Yeah, I do both. We ideally like to see the person in person the first visit, and then we can do virtual, but we make exceptions depending on the case.
Hmm. It's always good to see someone the first
Yeah.
time.
Yeah.
And you go down that list of 15 pages of
Uh-huh.
doctor engineer questions. Yeah.
Yeah.
Get started, and then you can do virtual after that. Sounds like.
Yes.
I've been speaking to Dr. Jill Carnahan.
Yes.
Her office website is Jill Carnahan, CARNAHAN.com. It'll be in the show notes. Dr. Carnahan, thanks so much for being on my show.
You're welcome, Daniel. It was a pleasure.
Take care.
Take care.